Good morning, everyone. My name is Asmita, and today I will be presenting my work titled Smartphone-Based Detection of Cancer Biomarkers in Biofluids. As an introduction to oral cancer is the third most common cancer in India, and it ranks ninth globally. The 5-year survival rate for oral cancer ranges from 54 to 60% if the cancer is localized in the mouth. 6.7 men per 1 lakh and 3 per 1 lakh women are affected by oral cancer. Currently, oral cancer is diagnosed using techniques like biopsy, blood tests, imaging techniques like MRI, and CT scan. The disadvantage of using biopsy and blood tests are that they are invasive techniques, and CT scan and imaging techniques require experts for determination. Nowadays, saliva is being proposed as a possible diagnostic tool because saliva has a number of advantages, like the collection of the sample is non-invasive, the collection methods are cost effective, it does not clot like blood, it requires less manipulation than blood, population-based screening and risk stratification, prognosis determination, therapy response monitoring can be carried out using saliva. And recently, a lot of salivary biomarkers has been found, which could help in the diagnosis of various diseases. So polyamine is a metabolite which is found in the saliva of oral cancers. So what are polyamines? Polyamines are positively charged nitrogenous compounds which are derived from amino acids, and it is a collective form of putrescine, spermidine, and spermine. So polyamines play different roles in cancer, like it provides proliferative signal to the cancer cells, it causes genomic modification, it alters the cell death program, it deregulates the energy metabolism of cells, it helps the cancer cells to evade the immune system and also causes inflammation, it promotes invasion and metastasis of the cancer cells. So metabolite analysis for the determination of oral cancer has been done using different techniques like mass spectrometry, HPLC, gas chromatography, and certain optical-based assays have also been developed. However, techniques like mass spectrometry, HPLC, and gas chromatography, they require experts for instrument handling as well as for data analysis. And the optical-based assays which have been developed, they have either reported a high detection limit or the detection limit was reported as not being able to detect at very low concentrations. So our aim is to develop a smartphone-based colorimetric detection system in which polyamines present in saliva samples will be detected, which will help in the early detection of oral cancer. For this, we'll be using a tannic acid capped gold nanoparticle. So for our work, we synthesized the tannic acid capped gold nanoparticles, and then we characterized the nanoparticle using different characterization techniques. Then the nanoparticles were incubated with different polyamines, and the color change observed was quantified using the smartphone-based app, which helped us in determining the intensity of the red light emitted by the polyamine incubated nanoparticles. Coming to the results, the nanoparticle was synthesized using a gold chloride salt and using tannic acid as the capping as well as the reducing agent via a microwave assisted synthesis method. The SPR peak of the synthesized nanoparticle was determined to be at 530 nanometer using the UV visible spectroscopy. ELS was also performed to determine the hydrodynamic size of the nanoparticle, which was determined to be 34.5 nanometer. Zeta potential of the nanoparticle was also determined to be minus 24.3 MV, which indicated that the nanoparticle was very stable. TEM analysis was also done, in which it was observed that the nanoparticles are almost spherical in shape, and the particle size distribution of the nanoparticle showed that the nanoparticles have an average size of 10 plus minus 4 nanometer. FTIR analysis was also done to determine how the tannic acid was able to reduce and cap the gold nanoparticles. So in this, these three peaks were responsible for the nanoparticle formation, which showed that the acidic groups of tannic acid, they bind to the surface of the gold nanoparticles to stabilize the gold nanoparticles, whereas the multiple phenolic groups which are present in tannic acid, they caused the reduction of the gold salt, which ultimately helped in the formation of the nanoparticle. Thus, tannic acid served as a efficient reducing agent as well as a capping agent. We also studied how stable our nanoparticles are at different conditions of temperature and pH. So for this, we incubated our nanoparticle at different temperatures, and it was observed that the SPR peak did not shift from 530 nanometer even after 24 hours of incubation. So this showed that our nanoparticle was stable from 4 to 60 degrees centigrade. The nanoparticles were also incubated with buffers having pH 4, 7, and 9.2, and it was observed that the SPR peak did not shift from 530 nanometer even after 24 hours of incubation, indicating that the synthesized nanoparticle is stable over a pH range of 4 to 9.2. The nanoparticle was also incubated with PBS and monitored over a time of 5 hours, and it was observed that there was no shift in the SPR peak from 530 nanometer, indicating that the nanoparticle was stable even in PBS. So the synthesized nanoparticles were incubated with the polyamine spermine, and spermine has multiple amino groups which hydrogen bonded with the acidic groups of tannic acid and caused the aggregation of the gold nanoparticles. As a result, the SPR band of the synthesized gold nanoparticle was observed to shift to higher wavelengths as shown in the graph. Similarly, when the polyamine spermidine was incubated with the gold nanoparticle, there was again aggregation of the gold nanoparticle. However, the shift in the SPR peak was less compared to when the nanoparticle was incubated with spermine, possibly due to less number of amino groups in spermidine. The absorbance of spermine incubated to gold nanoparticles was determined at 530 nanometer using a nanodraw spectrophotometer. So here we observed that with increasing concentration of spermine, the absorbance at 530 nanometer decreased, indicating that there was aggregation of the gold nanoparticles due to the presence of the polyamine. Similarly, the observance of spermidine incubated gold nanoparticles was determined at 530 nanometer. And again, the similar trend was observed with increasing concentration of spermidine, but the decrease in the absorbance at 530 nanometer was less compared to spermine due to less aggregation caused by spermidine. The nanoparticle was also incubated with different concentrations of spermine, and the smartphone app was used to determine the intensity of red light emitted by the incubated nanoparticles. So it was found that with increasing concentration of spermine, the intensity of red light emitted by the gold nanoparticles decreased rapidly, indicating that there was aggregation of the nanoparticle in presence of the polyamine. Similarly, when different concentrations of spermidine was incubated with the gold nanoparticles, the smartphone-based app was again used to determine the intensity of red light emitted by the incubated nanoparticles. It was observed. A similar trend was observed again, like in the case of spermine, but here the intensity of red light did decrease with increasing concentration of spermidine, but the decrease was less compared to when incubated with spermine due to less aggregation caused by spermidine. Thus, polyamines were successfully detected using tannic acid capped gold nanoparticles and the smartphone-based app. So this current invention can be used in the future as a POCT platform for early cancer diagnosis as well as for the prognosis of cancer patients. These are my references, and thank you.